Welcome back to another episode of Inside Medical Malpractice with Dr. Laura Fortner. If you haven't already listened to the longer podcast with Dr. Laura, please don't miss it. We talked about many things, one of them being her experience of being sued several years ago, how it affected so many areas of her life, and it motivated her to start a business called the MedMal Coach, which now supports other physicians through the experience of being sued. He also offers some great advice to healthcare providers on avoiding litigation and speaks to everyone about what she feels is the most important thing they need to know about malpractice. It's a fabulous episode, and you won't want to miss it. But now we're back here to talk about Dr. Laura herself, about some of her choices, her current life, what gets her up in the morning, and whatever else happens to come up in this conversation. So let's get started. Welcome back, Dr. Laura.
Thank you so much for having me.
It's a pleasure. And I'm glad we get a little more time to talk. We talked in the other podcast a lot about stuff that's very important. But I personally, and I'm sure our listeners would like to now know more about you as a person. And because there's no doubt that your background and your life experiences supported you in 1,000 ways in the work that you're doing now and the work that you've been doing as a doctor for 21 years. So let's first talk about why obstetrics, why OBGYN, because the hours are terrible and it's an incredibly tough, high-risk part of medicine. What motivated you to get into the role of an OBGYN?
Yeah, so when I went through medical school, honestly, it was the surgery for me. I just absolutely fell in love with the surgery aspect of caring for female patients. And so the experience that I had with some of my mentors there just solidified the fact that OB was for me. And I loved the fact that it was not every day, the same thing every day. You know, there were multiple different things that we did as an OBGYN. And I gravitated towards the surgery, but I did love, I love delivering babies. I love taking care of women and babies. And it was the only field that you really take care of 2 patients at once. And it's just such a blessing to be a part of a moment that is very special to everyone involved. So
that's true. I appreciate what you said about 2 patients at once. I worked in a very remote community for about 4 years up in the Yukon. And I'll never forget an Australian OB came to do a locum in the hospital that I worked in. And he wasn't an OB, he was a general surgeon. But because this was a small hospital and we only had one OB in the entire community, sometimes the general surgeons were called in to do C-sections. And I have never forgotten the first time I watched him do one, and he cut into the abdomen and the uterus, and then this baby came out. He just laughed and laughed and laughed and laughed. And he said, "I'll never get over this. I will never get over cutting into an abdomen and finding a baby in there." So it's interesting how you can never, we take it for granted, those of us that have worked in the area for a long time, but it is 2 people and that baby isn't always visible, but it's there the whole time, right?
Right.
Do you have any particularly fond memories of your work, let's say delivering a baby? Because that's just in everybody's heart,
Yeah, I have so many. I have so many. And right now, I feel like one of my biggest memories was just recently when I was, just running labor and delivery. And I really try to get to know my patients because I'm not seeing them in the office. And I talked to this couple for a long period of time, and they had 5 boys, and they didn't know what this baby was going to be. And they were obviously hoping for a girl. And it was just a monumentous moment when that baby came out and it was a girl, and just the reactions of the dad and the mom and me, like we all were like, and the nursing staff, we all were like, "Oh my God, this is so beautiful," and it was a really big, joyous moment. And I know it's something small, but just that one little thing was like amazing, right? And also sometimes I think about this, Chris, it's like almost amazing to think that a baby comes out and it is normal, like all the things that have to happen through the entire process. And most of the time, everything comes out normal, right? It's just a miracle. It really is.
It absolutely is a miracle. And I think, when you talked about being there, it's so lucky to be for that moment. Sometimes years later, like not too long ago, I was just having breakfast in a restaurant on a highway, 40 miles from my house. And a couple approached me and it's like, Chris, we've never, and this was 14 years ago. We've never, ever, you are a labor and delivery nurse. You're just so lucky to be there for that special time in someone's life. And you just can't ever, sort of think of it as a job. You have to always think of it as a special, special moment. So what do you do when you're not busy working? I understand you've got husband, kids, farm minimally. Tell us about that.
Yeah. So I married my high school sweetheart and he is a farmer. So we live on a farm. He does dairy cows and we raise chickens. So we have a lot going on and we have 4 children and they range from 22 right now to 12. So we're really busy. And that's what I do on my downtime is spend my time with my kids, my family. I do help out a little bit on the farm, but not a ton. I make my kids do it. Yeah. And beyond that, I love to read. Reading has been one of the things that has transformed my entire life. I think I've read since a small child, and what I've been reading for the last 5 to 10 years has been all personal growth and how to become the best version of yourself. So, do you ever help do your dairy cows birth and have babies in the spring? Do you ever do your OB work at home? Yeah. So I have to tell you this story, Chris. So like I said in the other podcast, I was in private practice for a long time in a group setting. And then I decided to change roles. And I actually stayed home for a little bit of time before I went back out and worked. And the first day that I had arrived home, that was I didn't have to go into work or do anything. My husband calls me at midnight and says, Laura, I have a cow and the baby won't come out. I need you to come down here and help me. And I'm like, I don't know anything about cows. He goes, no, I promise you, I'll walk you through it. So I go down there, put a big sleeve on, I'm trying to feel which way the baby's coming out because he needs to figure that out. And I helped deliver that baby. And it was really funny because I thought that I was going to start my sleep, because I had no sleep for years and years and years and years. And this is the first day I'm off and I'm like, oh, I'm going to get to sleep. And he's calling me at midnight and I'm delivering a calf.
There you go. And did that all turn out okay? You got that baby out and everything went well?
Yes. Yeah. But what's wonderful about the cows is most of the time they do it themselves, right? And all of a sudden you see them and their baby and it's the cutest thing, right? So it rarely happens, but that is a memorable moment.
It's interesting that sleeve that you talk about because I was, Calgary, where I am from, is famous for the Calgary Stampede. And so there's a big rodeo and cattle and horse component of it. But one of the things that the Department of Veterinary Medicine put on display a few years ago, and it was a big rainstorm. And so we all ended up in places you wouldn't normally go. And I ended up in this Department of Veterinary Medicine learning how to deliver a calf. And I can remember when they said and it was just a fake thing. It was all a model. But they gave me the glove that, went all the way. And I was like, where's this hand of mine going? How far are we doing that? But I also remember there's a lot of farming community around here. And a lot of the farming husbands would come in with their wives in labor. And when it came time to push, they'd talk about, get the chains, get the pull. And I'm like, wait a sec. This is not that. We don't have any hooves out front or anything. There's nothing to put chains on.
Right.
We're not going to put the pullers. So just simmer down there, big guy. And let's let this little, head make its way out, however it's going to come. But it's interesting how your skills work at work and at home. So what were you like as a child? Let's talk about that.
I think probably the biggest thing, I was very much into school. I loved school. I was one of those kids that loved school. I was an introvert too, but just had my nose in books, and school was it for me. Like, that was the most fabulous time. And I think one of the biggest things that cultivated who I am today was some of the teachers that I had along the way, because they really cultivated in me a confidence about how I could, with my performance and things. And I'm not from a family of physicians or, a long lineage of these high professional people. That's not where I came from. I came from a tiny town of 500 people in Ohio. So it was something that, I started young, and it cultivated confidence within me that I could become a doctor, I think.
Where are you in the mix of kids in your family?
Yeah, I'm the middle child.
Oh.
So, which is kind of interesting because, I think sometimes firstborns are maybe more likely to do these kind of things. But for whatever reason, I'm the middle child, and I was still that people pleaser and sort of negotiator, like trying to make everybody calm. But at the same time, I think what happened with me in school was the teachers almost saw in me that I could cultivate becoming anything I wanted to be. And I didn't have that initially, if that makes sense. And that was cultivated along the way. And I thought, well, I could do this.
That does make perfect sense. And a big shout out to teachers who do that. A big shout out to teachers who cultivate just that sense of accomplishment and what you can be. So great for that. If you hadn't become a doctor, what other profession might you have chosen?
I would have totally been a marine biologist. Now, I don't know how many people would say this on this, but I love the ocean. I just love it. And it is one of my things. It's like my calming place. I wish I would love to live on the ocean, but that's not in the cards at the moment. However,
because you're in Ohio, yes, there's no ocean in Ohio.
No, but I plan on having a home one day on the ocean. But I just love. I learned to scuba dive and learned to snorkel and do all those things. I went on trips, marine biology trips, and those kind of things through high school and beyond. And it just cultivated that sort of love. And so I would have been that. I think one of the crucial moments of my life is I started saying, maybe I'll be a marine biologist instead of a doctor. And my mom especially just really sat down and talked to me about those things, and recognizing sort of the different paths and how that might, be on my future. I chose obviously to become a physician then. So, and do that more as a hobby.
Yeah, good. Well, you're obviously a kid who listened to your mom, because that isn't always a successful conversation, to talk about the realities of a chosen profession, or to try to guide someone in a different direction. It's, impossible sometimes, or it seems impossible. So are you happy with your decision?
Yes, I think in the thick of things, I might have maybe been a little bitter when this was all happening to me with, when I first got sued. I definitely had some sort of thoughts of like, why would I do this? I can't believe I did this, that kind of thing. But I am one of those people that, when I learned to kind of switch my story, it's made me who I am. And I love it. Like when I go and do it now for the 24 hours that I do it, it's just a joy. I get to be a part of something that that is just such a special moment. And then I get to go home and be with my family. And so it's just such a beautiful joy that I wouldn't be able to do that if I wouldn't have, been on this path.
Interesting. And is it the joy that gets you up in the morning, or what is it that gets you out of bed every single day?
Yeah, I think now what gets me up is knowing that I'm making an impact on physicians to help them through this process. When it took me years to figure it out, I'm helping them right at the start of something happening to them so that they can get over the hump. And that gets me excited. That gets me up. I have so much purpose in this. So, and there's really, it's been really for the last, and I know sometimes I don't sleep at night thinking about what I can do to help people in this arena and how I can make a bigger impact. And I think that's good. Like before I wasn't getting sleep because I was so worried and about my case. And now it's, how can I help this situation?
I think that's a brilliant thing to keep you up at night. And I don't know, like I know when I first started my business too, there were a lot of sleepless nights and sometimes literally up all night, just thinking and planning and hoping and praying and that things would go well. And, you know, you can't even, and I'm a little farther down the road in this than you are. We talked about this a couple of days ago, but I couldn't have even predicted that it would go in some of the directions or as well as it ended up going. So, but it's essential in that beginning when you're just starting to have that excitement and that motivation and the awake nights to do your planning and your thinking, hoping, because, you know, it's a journey. It takes a lot of grit and determination and confidence and courage and healing of your own stuff to get through this. So what would you say at this point in your life is your top strategy for life success? Because you've gone through some stuff like many of us have. What's, like if someone wanted to know, wow, that Dr. Laura, how does she do it? What would you have to say about that?
I would say is figure out how to turn your pain into purpose, because this is what I've done. And the funny thing is, Chris, you know, when I was in my deepest moments, darkest moments or low points, I always felt compelled that there was something I needed to do, and I just didn't know what it was. And it became clearer and clearer through healing. And so, you know, we all have obstacles. Every single one of us, like even if you're listening and you're just a healthcare worker and none of this applies to you right now in terms of getting sued or any of that stuff, like we all have obstacles. We're all facing things that most people don't know what's going on behind closed doors. And how can you turn that around to make it a purpose and be where you want to get up out of bed every day and keep going? Because I think that is what life's about. It's playing all in. It's being the best version of yourself. And when you're the best version of yourself, it bleeds into every aspect of your life. So, you know, I started just turning this one little pain that had been a massive pain and trauma to me, really trauma is really what it is. Yeah. And I have been able to turn it around into a purpose. And I started doing that, which then started to build this incredible relationship with my husband, this incredible relationship with my kids, when I started rebuilding that. And so just doing that one thing changed everything.
Well, I think that's the soundbite of this podcast so far. It's learning how to turn pain into purpose. That's brilliant. And I think when you look at longevity and happy long lives, I mean, having a purpose every single day, even into the later decades of your life, having that reason to get up every single morning is the key. So well said. And I'm so glad that was a part of your journey that you shared with us. Thanks for that. If you could go back at this point in your life and speak to your younger self, your book reading, wanting to be a marine biologist self, middle child self, what advice would you offer her?
Well, two big advice, I think. One would be look at your obstacles as opportunity instead of an obstacle. I think that's one of the biggest things, is taking any type of obstacle you have and looking at it as an opportunity in any way that you can. And then I would tell her to create boundaries sooner. I mean, I'm a people pleaser at heart. And I think that I waited too long to create some boundaries in my life. And when you create boundaries and are able to say no to things that don't have as much meaning to you as those things that the yes does, you know, like when you're able to do those things, it transforms who you're being. I mean, it really can be freeing to you. So.
Were your boundaries that you needed to set professional or personal or both?
I think a lot of it was professional, like constantly saying yes to always doing more in terms of working because somebody needed me. And I knew internally that wasn't helpful, but I kept saying yes, even when I didn't want to say yes, And I think a lot of us that go into the healthcare field, we feel this way and we do this. But at the end of the day, just like I talked about, having self-care, like if you're not taking care of yourself, you can't take care of patients well. And this is one of those things that you can take care of yourself by saying yes when you mean yes and no when you really don't want to.
I can only imagine that must have been like 4 kids and a farm and a husband in an office in an OB practice and a personality that gave you a tendency to say yes when you should have or could have said no. You must look back on that time and felt like you were spinning off the face of the earth sometimes, I would imagine.
Oh, yeah, 80, 100-hour work weeks. Like just crazy stuff, like stuff that most people wouldn't do, right? But I think, again, the training that we go through, we just sometimes get caught in that trap. Or, you want to please other people. You want them to think highly of you. And you think that yes is going to do that. But honestly, a no can do that too.
Yeah. That's really good advice. A people-pleasing personality could be 1,000 shows on their own, right? And how that affects your life, in so many ways. So let's flip that a little bit to that same question I asked about talking to your younger self. What advice would you give to physicians? And maybe if you could answer this on two parts, physicians in general and OBGYNs particularly, what advice would you give to them just starting out in their career right now?
Yeah, it's funny because, my son came home who's going to graduate as a mechanical engineer and he's going to med school, he told me. So, and he told me not to talk him out of it. So,
here we are talking about it.
And what did I say? Expect to get sued. I will help you through it. No. But I think one of the best advices we could give to the younger generation actually is start educating them on this will probably happen to you. And until we get malpractice reform or something major happens, like this is the reality of what happens. And for you to learn some of these tools now, teach them how this brain science, teach them how to think and how to separate facts from the story and the thoughts that they're having, like teach them these things, I think could be massively impactful for our next generation of physicians. And I would tell them to go do personal development, be open to other entities to professionally develop them, as well as going through their medical career, and not just stop at that MD or that DO. Have that expansion so that you can get through things that you will have to get through. We see things in medicine, outcomes that happen no matter what we do. And most of us repress and resist the emotions that come up when things like that happen. And we carry that around then.
Yeah, you do. And you don't even know sometimes you're carrying it around. I had a personal experience where I had a miscarriage late, like at 17 weeks. And I got through it. I just got through it and I did what I did and I coped because that's what you do. And I went back to work. And probably 3.5 years later, I applied for a position on the labor and delivery unit at the hospital where this had all happened. And, I thought it was all behind me. It was over. It was done with. I dealt with it. And I'm sitting in an orientation day with a bunch of other nurses and pastoral care that came in to speak with us about pregnancy loss. And I just lost it and ran out of the room. And it took me a while to recover from that. And I thought, you know what? It's going to catch up with you. Whatever your stuff is, it's going to find its way to you. And one day it's just going to knock you right on your butt if you don't kind of cope with it at the time or as soon as you can and in the right way. So I think that is also really great advice. So without talking too much about your son deciding to go into medicine, what are your thoughts on your son going into medicine?
Well, first of all, this is a kid that at 12 years old, when we are dehorning and, doing some things to calves, he passes out. So I'm thinking there's no way. And he used to tell me, oh, I'll never go into medicine. But again, I think going through schooling, and he went through mechanical engineering, he's going to graduate here in May. I think he realized, like, Mom, I want to be active. I want to perform. He wants to operate, he doesn't want to sit behind a desk. I think he recognized that. And I think he saw a role model that in me, which he won't say, I don't think he'll admit, but that it's possible for him too, because again, we don't have a lineage of that. And I think that his mind opened up to the possibility that maybe I could do that and be successful at that. And I'm really proud of him. Like, I think he's going to be an incredible doctor with whatever he chooses. And I'm so excited for him. He does have to take a gap year to finish his pre-med courses because he hasn't done them, but he's working on it. He's the only senior probably at college that has a massive full load trying to fit all these classes in. So that's something to be said for that. So.
For sure. And I think, the day will come. I mean, he's young. The day will come when he'll recognize your role and your influence on his life. But I also think it's a true testament to you that you've not only shown him the possibilities, but you've shown him the struggle and the overcoming in a way that you realize that you can look at all aspects of what you're about to jump into. Because so many times we're just like, I want to do that. And you get there and you're like, I don't actually want to do that at all because I did not understand. I had no idea that it involved so many things. So a testament to you that you've shown him the possibility and the reality of what it means to be a doctor. And he's still going for it. So again, without talking too much about his decision, I'll just say congratulations to him and to you.
Thank you.
And wish him the best and hope it goes well. I have no doubt that he'll be great with a good example like you at the helm. So just a couple other questions with you. I'm being respectful of your time and the listeners' time as well. But I want to ask you two more questions. What is the thing that people most often get wrong about you?
Well, I think in the public, so really not patient wise, I don't think, but in the public, I am a little shy and introverted, like if I'm introduced to a whole new group of people, it's harder for me to go up and have a conversation with someone. And so I think they get me wrong in that I might be a little standoffish. But I think they quickly realize if they do start talking to me is like, I just have a little fear of like getting out there myself and putting myself out there and going up and introducing myself to somebody. It's hard for me to do. I think I've always been that. I tell people when I was in high school, my husband was the social one and I was the one that stood in the corner, with the one best friend, because I just didn't know how to navigate initial conversations. And I think I've gotten better with that over time. And I certainly have overcome like my public speaking thing that I used to have. So, but I think that's one of the things, like, if you see me, you can absolutely come up to me and I will love that. It's just, I'm a little introverted, slightly shy in the beginning. Yeah.
Well, I would say I would have gotten that wrong about you too. I would have never guessed that you were introverted. You seem very confident and well-spoken and outspoken. And, but, we've all got our things, we've all got our things that we have to struggle to overcome. So good on you. You've done a great job of overcoming it. I would have never, ever said that you were an introvert. So it's an interesting thing to hear.
Yeah. Several years of personal growth, right? Like I've really coming out of my shell. So yeah.
Right. And age and experience brings so much to the table, doesn't it? You just hopefully get a bit smarter as time goes on. So one last question. Who has been a very important influence on your life, real or otherwise, and why?
Yeah, so I think, like I said, I had one specific teacher in elementary school that I think was sort of a turning point of who I thought, like who I knew I could become. And her name was Miss Keller, and she just I don't know, transformed the thinking of who I really was and who I could be. And then I also, I'm going to talk about my husband here, because I think one of the things about him, he has unconditionally supported every single thing in my entire life in a way that gave me space. And at times I never recognized that. But I recognize it looking back on all these things that have occurred. And, we're talking about my lawsuit and getting sued. And of course, there were multiple things along the way, not just that. I mean, that was a major event, but there are major events. I mean, my brother passed away, like all these things happen. And to have someone that just can unconditionally support you and not in a way that gives you the space to grow into whatever you want to become, no matter what that looks like, I think is an incredible person to have in your life. And I think it's not always easy to find. So when I think about that, I think he's probably the number one person that has a huge impact. He also has so much faith. And I don't know where I was with that, prior to him. And so he's been a rock for me in so many ways. So I got to give him the kudos.
That's really nice to hear. And a big shout out to your husband and to your whole family, I think. I just have a question. I'm wondering, what age were you when that teacher spoke to you and made you realize possibilities? Just wondering.
I was 10. I was 10. It was fourth grade, so it would have been 9 or 10. I remember I have memories from that classroom and her, and and now she's gone on and married. She was unmarried then, she's married now, and I know who she is in the community and things, but it just, the things that she said to me were just so impactful, and it's so impressionable. I must have been at the ripe age of really believing that, taking what she said and believing it myself.
So for there might be teachers listening in. Can you recall specifically something that she said that made an impact on you?
She said, I remember her talking about how she just said your ability to be able to turn around and as soon as I teach you something, you're able to learn it and do it. Like, she was cultivating this, and it wasn't a grade. It wasn't oh, you got an A. That wasn't about the A's or the B's or anything. It was, she specifically spoke about the tasks at hand that I was good at. That's what she did. So
that's brilliant.
Yeah, I think it's and she caught me in action doing it and reinforced that.
That's really brilliant. Well, thanks for sharing that. And shout out to the teacher, shout out to your husband, and to the son that we're not talking about at all, and to you for all that you've done. So thank you, Dr. Laura, once again for joining us today. It's been an absolute pleasure. It's been really insightful. I just want to mention once again, if you'd like to connect with Dr. Laura, if you're a physician who's struggling through some issues with malpractice or being sued or want to learn more about this, there's one-on-one and will be group coaching sessions on getting through it. You can find her at the medmalcoach.com. Again, she has several blog posts and a free publication called Common Myths about medical malpractice. And very exciting news is that her coaching qualifies for CME credits. So thank you so much again for being open. It's been, like I said, a pleasure learning about you and talking about you. I think it's an incredibly valuable service that you're offering, and I wish you nothing but success and the best outcome going forward.
Oh, thank you so much. It's been such an honor to be with you and talk with you. And I'm so excited to share and to help healthcare workers thrive through these times. So thank you so much.
You're so welcome.